it's too expensive. Well, now you can see a real MD and get a prescription, all from your own home and for a rather reasonable price. Linda Yee on the trend toward virtual medicine.
When Dr. Sun treats a patient, it's not always in person. He's also a web doc. A patient with a laptop and a webcam can get medical care online.
When I move my wrist a lot, the pain is actually really sharp.
This patient did not want to use her name. She went online to get help for a painful wrist.
Do you have any thyroid problem?
She follows his instructions to help diagnose her problem.
It hurts to do this, really.
Diabetic patient Stuart Alpert got refills on his meds this way.
I didn't have to spend time waiting, spend time going, sit in a big room with a bunch of sick people. I got to see a doctor in about 10 minutes.
Doctors Express in Newark says besides in-person visits, it's the first urgent care clinic in California to offer web service with their doctors. Log in, pay the $39 fee, fill out a medical history, and the doctor is called. The visual diagnosis works with minor cuts, rashes, or bites, for example. Can't swallow,
Right.
and I've got a fever. For internal issues like headaches and sore throats, web docs rely on the patient's description of the problem.
80% or 90% of the time we can base on the statistic and the past experience.
It worked for this patient who can't find time between classes and work to see a doctor in person. She trusts the online medical help.
Even from the questions that he was asking, I think it was obvious that he knows what he's talking about.
Alfred got his refills by showing Dr. Sun his medications.
He said, "What are you taking?" I told him. He said, "Do you have the bottles nearby?" I said, "Yeah." I held up the bottles to the camera for him.
And you think it's safe?
In most cases, I think they're pretty safe.
As the population ages and technology gets even better, virtual doctors and virtual patients will become more commonplace because they're only a couple keystrokes away. But patients have to be vigilant, know who the doctor is. There are companies popping up online using presumed doctors from outside of the country making diagnoses.
We're not necessarily sure if their training or their expertise.
And symptomatically, how's he doing?
It's that Dr. Seth Boxer doesn't trust virtual medicine. He is the telemedicine medical director for UCSF's Benioff Children's Center. This is a mock-up of a future hospital room. Telemedicine is being built into the new UCSF Medical Center, now under construction in San Francisco's Mission Bay. The technology will also allow doctors to perform actual medical tests online.
They could examine a patient virtually. We could listen to heart tones. We could listen to respirations. We could even do otoscopic exams. And we're starting to be able to deploy their images. So do ultrasound, respiratory monitoring. I guess this is the 21st century version of the house call.
It's really big.
It's not science fiction. The future is now. In San Francisco, Linda Yee, CBS 5.
So what's the downside? Well, the insurance companies, they haven't caught up with the technology. So for now, most virtual medicine is not covered.
All right, look.